Alors, bonjour à tout le monde. Nous vous souhaitons la bienvenue.
Hello, everybody, and welcome to this webinar. I am Josepha Abousse. I am regional advisor, or I should say I am regional manager for the program AYSRH in TCI, and I have the honor of facilitating this session. And I will be joined by 3 panelists that I will introduce to you in a little while. We know that the colleagues who are connected from all over the world, so I will ask you to give us 2 or 3 minutes more so everybody can get connected and so we can start this session, which will be a very interesting session because it will present adaptations that we had to, tailoring that we had to do to pursue the implementation of activities for AFP in cities and supported by TCI. So I am asking you for just maybe 1 minute or 2 of patience so we can start this session. That is so expected. And many of you have signed up and are connecting, and that is something that that makes us very happy. So just a few minutes before we start. So, but I will start by giving some technical advice. The whole webinar, all the presentations will be in French, but there is a little symbol that looks like a globe, like the Earth. It says interpretation. So click on this, and then you can choose the channel. There's English, there or French. So you can choose the channel. And then you can have at the same time the interpretation that will be done simultaneously. So we're going to speak French a lot, so the interpretation will be mostly in English. And we will try to speak a little slowly so that the interpreters can actually interpret what we are saying. And so all the people who are following us from the United States or from all over the world, all the English-speaking attendees can understand what's being said. So please give a little patience for 1 or 2 minutes and we'll be done. Thank you, and see you in a little while.
Il faut que ça marche parce que ça ne doit pas sortir dehors comme on l'entend.
Bien. Je pense que nous allons démarrer parce que
I think we're going to start because time is not always our friend. What form of tailoring for continuity of the TCI model in the context of COVID-19? This is the title, the theme of today's webinar. The interpreter apologizes, there's a lot of noise. We know that we are in an unpredictable world, and so we were surprised by the pandemic, COVID-19 pandemic, and the healthcare system was hit really hard by this pandemic because it really shook up the healthcare system, but it must adapt and find its balance again and improve its performance, both in the FP area and in the services to adult, youth. Now, TCI supports cities, so they can scale up all the approaches in FP and also in sexual and reproductive health. But how were we able to do? What are the adaptations that were made to support? So what is the resiliency level? Have we been able to start by improving our performance? That's what we're going to discuss with our three panelists. First of all, the first panelist is Mrs. Monique Koulibaly. So I would like to ask Monique Koulibaly to activate her video and her microphone so that we can see her and so she can introduce herself quickly. Ms. Koulibaly, can you? Okay, thank you, Josepha. So this is, I am Mrs. Koulibaly, and I'm from Abobo, and I'm talking, and I work about the focal point of family planning, and these are, so there are 8 districts that say thank you because it's very, we have providers for the population, and we have Kumasi, Aljube, in Makorish. Thank you very much. Thank you, Ms. Koulibaly. Now we're going to go to the second presenter. She's a young transformative leader. And we must remind quickly that in the high impact approaches of TCI in West Africa, Francophone West Africa, we have young leaders, and they continue the improvement on the environment for the implementation of the program through advocacy and participation. And we have today young leaders in 9 cities in West Africa, Francophone West Africa. And one person represents them in this panel. It is Lauren Kawal. Lauren, can you introduce yourself? Lauren, your microphone is muted. Okay, first of all, thank you for giving me the floor. Good morning, everybody. I am Commander Lauren Maganila. I'm in charge of advocacy for the young leaders in the city of Koudougou. Through my voice, the young leaders of Koudougou and Francophone West Africa send you their good morning wishes. Thank you, Lauren, for this brief introduction. You're welcome. So I would like to give the floor now to Mr. Wahab, the third presenter, and he will talk to us about municipalities, because the healthcare system has been able to implement adaptation to pursue activities. There are young people who have been able to put together adaptations, but also city halls have a financial commitment from TCI for the FP programs, and the AYSRH also, and also give some adaptation to pursue their leadership. And Wahab is on this call with us to talk about these adaptations that have been made at the city level. Wahab, you have 1 minute to introduce yourself and give one word as you wished. Thank you, Doctor. Good morning, everybody. My name is Kentrebego Wahabo. I am a young transformational leader in the city of Ouagadougou. I am also a focal point for AYSRH in the municipality of Ouara. So I'm taking the floor today, this morning, to talk about the elements that will allow us to ensure political and financial commitment of communities for all the countries of Francophone West Africa. So it's an honor for me to be a panelist in this large international workshop. And of course, in this context, it's really nice. And I would like to, first of all, thank all the managers in Ouaga and in Burkina Faso and also at TCI also to give me this opportunity, without forgetting all the young leaders in all the Francophone West African countries. Thank you, Wahab, for your introduction. Now we're going to start in earnest with the first presentation. There will be 3 presentations, and after these presentations, we will go to the Q&A stage. You have a chat box that is there, so you can ask questions in the chat box, and we will review them and give answers to these questions in the second part of this webinar. So 3 communications. The first one is about the healthcare system. The second one will be about the young transformational leaders. And the third presentation will have to do with the political and financial commitment of municipalities. So I will now give the floor to Monique Coulibaly, who will talk to us about the strengthening of the healthcare system in the COVID situation. How were they able to ensure continuity of the services? And it will give us the example of Abidjan and Abobo, of course, but it's roughly everything that happened in West Africa. So, Monique Coulibaly, you have the floor. Thank you, Josepha. But I wanted to clarify that you have only 10 minutes for your presentation. Okay, thank you very much. The slides come from you? I'm waiting for the slides. It's really small. Can we enlarge? No, we cannot enlarge. Monique, can you hear me? Yeah, but I'm having trouble reading. It's really small. Is it something that needs to be done on your computer? Josepha, it's already in a slideshow mode. So what Monique has to do is maybe enlarge. I don't know if she's using her computer or her cell phone, but it's already in slideshow form, so we cannot enlarge more than that.
Monique, c'est bon?
Monique, is that okay? Well, I really can't read. So you use the PowerPoint that you have over there, and you tell me to go to the next slide, and I'll do it. Is it possible like that? Yeah, yes, it's possible. Use the slideshow at your level, and you just say slide, and I will switch to the next slide. Okay, so just 2 minutes to recover here. Okay, to give Monique some time to have the slides in front of her. Can we maybe go to the next presenter? Sure, that's a good alternative. So the young transformational leader who will then speak first. Lauren, can you present if we handle the slides? Yes, no problem. Okay, so let's go to the Lauren's slides. And the time Monique will recover the presentation and get ready to speak right after you. So, Lauren, you have the floor. Okay, thank you very much for giving me the floor. Like I said earlier, I'm in charge of advocacy for the young transformational leaders. It's a pleasure for me to take part in this webinar representing the young transformational leaders from Francophone Africa. I will talk to you about the theme of substantial commitment of youth, thanks to the JLT, the Young Transformational Leader approach. Before going any further, it would be appropriate to emphasize that before TCI's arrival in Francophone Africa, the youth did not have the opportunity to sit at the table during the decision-making. We were more in the awareness and mobilization. So we spent the time receiving the decisions that people were taking in our place. But since TCI, we have more participation and we're more involved in the decision-making, which allows us to give us our opinion during all the decision-making meetings in our various countries. Next slide. So it's also appropriate to point out that with the advent of COVID-19, we were faced with many difficulties. Of course, the challenge of affirm ourselves, the responsibilization challenge, participation challenge, a challenge of reduction of unwanted pregnancies in schools and universities, the challenge of access of the youth to all the AYSRH services, and the challenge of improvement of the healthcare services, and also challenge of capacity building so we can be there if we can participate.
We have to emphasize that with the arrival of the JLT, we had to find an approach that enabled these youth people to have a dynamic approach to this work. So this approach consists of advocacy for the improvement of services in terms of sexual health for youth and adolescents, to increase the involvement of young people in decision-making, to engage themselves in participating actively in various programs for family planning. We also need to underline that this approach is different from what we have seen before this, because with TCI, young people have this ability to give their point of view, to participate in various brainstorming sessions, to find solutions to the problems they face. We also have to note that JLTs are a different type of entity than what we're used to. Before, there were entities this basically makes us realize that we are autonomous. It's legally an independent entity, and it can lead its own activities. The various advantages of this approach is that this approach promotes a favorable socio-political environment for AYSRH and increase political involvement by young people in the implementation of various programs and also the participation in the various decision-making entities. And this means that we can have a very special approach to the problem, given that the principals are committed in the work and they can be aware of the needs. Now, in terms of implementation of this approach, a roadmap for implementation was set up. So it has 7 steps. First, it's selection and establishment of the JLTs. Now, this first we established selection criteria for the JLTs. You have to be between 15 and 24 years old. You have to be girl, boy, you have to be a member of an organization. You can be married or not, you can be one. And then you have the establishment of the various offices in the regional offices and the country offices. And then you have that's the second step, is formalization of the existence of the JLTs. It's establishing legally recognized cases so that they can be recognized wherever they go. So they have papers, identification that show their identity. Then you have the involvement of the JLTs in the AOI-SRH programs. So they can take part in various decision-making meetings with the steering committee, and they participate in this committee. And then you have to strengthen their capacities. So it's to identify those who will be trained as coaching JLTs. So in terms of transformational leadership and for advocacy efforts. So, and then you need to give the JLTs a location so that they have a headquarters. Now, the 5th step is coaching of the JLTs. So we have different coaching modules that enable us to strengthen their capacities. Then the next step is to connect them to the other networks. And that means it's not sufficient to just create this JLT structure and leave it alone. They need to be presented, introduced to the various other networks to facilitate their involvement in various programs that will take place within their structures. The last step is the monitoring and evaluation that makes it possible to ensure that JLTs are able to perform the various activities they're supposed to. Now, in view of their activities, the JLTs face several challenges because of the COVID-19 pandemic in particular. First is understanding that our primary action is not awareness raising, but rather advocacy. We can understand that because before the JLTs, we were more about raising awareness. We have a tendency to think that things haven't changed, and we're really trying to improve this aspect. Now, the difficulties in advocacy efforts are another challenge because this is due to the restrictions linked with COVID-19. Like in Ouagadougou, the mayor has had difficulties in organizing advocacy workshops with various entities. That's due to the COVID-19 restrictions. It makes it difficult to gather people in one room for a meeting and to have effective advocacy efforts. We hope to soon be able to do this, however. Now, with the arrival of the pandemic, the JLTs had to find another approach to ensure the continuity of their advocacy efforts by limiting the number of participants in meetings and during the decision-making meetings. Sometimes it's difficult to limit the number of participants, so they've done online meetings and campaigns online. Now, this new approach, TCI supported us in this approach through training that they've provided, through support they've provided, and coaching. There was JLT training in Ouagadougou, and at that time, they took this opportunity to lead advocacy efforts. And the mayor was very receptive to these efforts. And in the following week, he acceded to our requests. Now, with everything that has already been done by the JLTs, there are already many visible results that we can see. People have noticed young people's involvement in the various decision-making meetings. We have the JLTs from Koguku who took part in the steering committee meeting. And then those of UCOs who took part in the technical management unit meeting last May 3rd. Now, on April 19th, they were able to obtain a memorandum on the harmonization of costs for family planning services. And we have to note also that the Ouagadougou JLTs participated in the Garba Festival. There were many young people present, so they really took advantage of this occasion to lead activities to reach the JLT's objectives. With the pandemic, now, how are we going to continue our various activities? First, we're going to continue in the same line, respect prevention measures, having online meetings or limiting the number of participants. With the virtual meetings have been a way of proving that this was something that we could use as a tool that we could lead campaigns online. Following the efforts that have already been made, we propose that the JLTs, we were giving them some advice that are going to help them to achieve great things. We're going to tell them that they should insist to meet the authorities and to meet with traditional chiefs, because sometimes it's hard to contact them, but they can't give up. And they need to support the mayor in advocacy efforts with economic operators. And we need to tell the Ouagadougou JLTs that they need to do advocacy with the mayors of the arrondissements. Now, as you see, these are photos that really show the activities of the JLTs here. This is a picture from a training session. There's a picture from that shows the participation of the JLTs in the Garba Festival. You see the motivation is there. That's a photo of one of the Ouagadougou JLTs taking the floor during a training session. So thank you very much for your attention and for the opportunity to share this presentation with you. It was a great pleasure. And I really hope I managed to make myself understood. Thank you. Thank you, Lorraine. I can see that she's being applauded. I can see, and I think all the JLTs have applauded her. So through this presentation by Lorraine, we have understood that the transformational youth leaders movement is very unique. It really emphasizes advocacy and the participation of young people in decision making. And we're going to continue on this topic with Wahab as well. then there was also this issue of the strengthening of the JLT's capacities. And this was accomplished with the training sessions that were conducted online, bringing together several towns. And so these sessions, there were also locally organized sessions, thanks to TCI. But the JLTs are saying there's still work to be done. Because of course they have the problem of facilities, obtaining facilities. So these have to do with advocacy efforts. So they need to work with mayors in order to obtain offices in which they can complete their work. Lorraine spoke of some results that were obtained, the memorandums that had the objective of reducing by 50% the cost of contraceptive methods in several cities. And she talked about different examples of actions that are starting to bear fruit. And I really noticed one of the challenges that made me smile a little bit. It was this challenge of being able to go from a role that was normally assigned, recognized as being young people, and they're going from that role to being people who work to transform the environment for the implementation of AYSRH projects and through advocacy and their participation. Now, in this presentation, I think we can see that transformational youth leaders in West Africa are really taking up this challenge and now really need to deal with their environment, which is not always favorable. You know, there's of course the political aspect and anything that is not favorable to transformation. So we're going to hold off on questions for now. We're going to give the floor to Ms. Coulibaly, who is going to talk about the strengthening of the health system during the COVID-19.
Okay, thank you very much, Josepha. And hello, everybody. I want to talk to the strengthening of the healthcare system and how can we ensure the continuity of the provision of quality services and the approach of the special days FP in the context of COVID-19. So before COVID, we are in the Abobo city, which is the most populated in Abidjan. So there are 26 service delivery points that, and they all offer FP services, and the population is 695,744, including 168,744 women of reproductive age. Before COVID, the coverage rate for contraceptive methods was about 9%. And there was a community relays network, youth that were helping us, give us the advice to the population to embrace this concept. And so implementation of TCI intervention with the municipalities since December 2019. So I have to say that the demand was always increasing for contraceptive methods. And we have 9,210 new users of AFP to recruit with PCI, and also the capacity building of the providers in contraceptive technology, which helped us having quality personnel for long-term durations, long-term methods. So it's essential to take care of them efficiently so they can be satisfied. And so with the implementation of these programs and FP methods, we have been able to do that. Improvement also of the offer, the FP offer, with the implementation of ISBC and the organization of special days with the free offers. What does that mean? A woman can come to an examination for FP, and the personnel who is in front of the woman has to be able to see that she has FP needs, and they bring us through our information to adopt a FP method. There are some special days where they offer free services for the low-income people. So these are times where people really come, and so it can improve their conditions of life and their health, and also strengthening of the activities for services of family planning, using media, mass media, home visits, and training of women in the markets, because the women come to us. They get the information. They're going to pass that on in markets in their homes. So we have high impact interventions that have been implemented. So there are special days for where we offer free services of FP. So we go to the most remote and the most underserved population. So we don't stay only in the areas that are really well served, but we also try to reach the largest number of women, and they embrace really our project. And with ISBC also, we have been able to have an influence in FP. So they can really embrace FP thanks to our activities, and that helped help them. And also capacity building of the providers. When a person comes, if we do a good work, it encourages them to bring more people. So we have been able to build the capacities of providers thanks to TCI. So all the FP activities can be done with a personnel that is well trained and well equipped. The interpreter does not hear. Okay, for ISBC, we had to train instructors, we had to train the trainers. There's not very many city halls and district, so we also had to train providers on ISBC. And we also put together management tools for the approach in the health centers, so they can refer to people who have a ISBC training in the FP centers. And so they can give a report at the end of the month. And also the monitoring of the implementation of ISBC through coordination meetings that are done in the district, and also overseeing the health services to see to what extent ISBC is effective, and also what we need to fix and what we can improve. So special days. We have the monthly planning of special days that's done with the healthcare tools. We say, okay, we want to do a special day in such and such structures, and we give dates that are good for them. And from there, we organize special days for 3 days. And the activities are now, the announcement of the activities is scheduled. And so we inform everybody that we will have one special day in FP at such and such structure. And so the information is shared with the managers and the women, because we give information to the women, they pass it on to the communities, and we see women that come from these areas, the NGOs that are in charge of adolescents and youth. And so they can recruit youth that also come to our programs to be served with the methods of contraception. And also we're trying to reach households couples and individuals, so that and there's awareness raising work that is done there, so people can come get help, and also implementation of activity on the site during 3 days. So this is done freely, and all the contraceptive measures during 3 days. And which is fantastic, that the women embrace the methods. These are not business people; these are people who are just manage. And if they have long-term methods, they can do their work normally, and they can forget all these concerns, and also they can be comfortable to really do the social activities that are helpful for them. And so for them, all the long-term methods, they have to be in sufficient numbers thanks to PCI. So it gives us a large number of products that we can use, and we are satisfied of this. So I have to say that in spite of COVID, we tried somehow to put together some activities so that population would not be harmed. There's healthcare services in general and FP in particular, in spite of COVID. So you had to raise awareness, you had to talk about vaccination. But in spite of all that, we had time to do FP activities as well, so that women will not be in a horrible situation. And so you don't want to do activities that would take you away from your children, from your parents. So with the training we gave them, they were able to do that. So the special days, it was difficult to organize the special days because we had all the measures that we had to follow. You could not go over 50 people, and also it was hard to confine people. But with the training, I think the sound disappeared right now. So to do this, we had to raise awareness of the population through mass media on the COVID-19 pandemic. The interpreter apologizes, but the sound disappears. It could be religious leaders, community leaders, so everybody could be informed on COVID so that we can live with it by being protected and taking all the appropriate measures. So even by doing activities, we are not threatened. Also, inform population on the availability of other services. In spite of COVID, there's FP services that are there, vaccination services, medical services, so people can get medical help. So there's COVID and there's other diseases, so the message went through, and you have to raise awareness of the women on the use of long-term methods in the context of COVID-19, so they can keep working at home. So they have to stay at home with their husbands. And okay, so we organized special days. We had to raise awareness of women and households about the special days, insisting on to respect the measures, the health measures at the site level. The day of the activity, we give masks to people. People have to wear the masks, and we applied systematically hand sanitizer for people before they can access before they access the tent. We put the chairs in such a way that there is at least 5 feet of distance. And thank God everything went well. They were respecting that. They were wearing the masks and social distancing. so we could reduce the risk of contamination, and also the use of hand sanitizer. So we had little talks on PF before the start and during the activity. So there are midwives who come to talk about FP, the methods that we have, and also the disadvantages of some of these methods and how to handle that. And also we put together small groups, so there's not a large number all at once. So that's a picture of a special day. You can see people wearing their masks and midwives who come to give information. The women who are separated by about 5 feet, and people who are here to have a system that where we can work efficiently. So here are some main results of our activities. So the specialists were interrupted for a month in March. So we didn't see the increase that we saw at the beginning. And people were actually afraid of coming. But the information that were given, they finally came in large numbers, just not quite like the beginning, but they came. Instead of having 500 or 600 people, we had 150 or 200 with COVID, but they were coming. But right after that, between July and August, we had 1 month where we could not work, but in September, we started the activities again. And November, December, same thing, we couldn't work because we didn't have enough products. So it was difficult to do things. So this experience with TCI in the context of COVID gave us a possibility to organize special days in the context of COVID-19 while respecting the measures, the health measures. So it's possible if we follow the advice that is given, we can work with managers and with the women, and it's necessary to have a good organization upstream and during the activity. Like I said, there was information, there were district meetings, information with mass media, and also information with the women in the markets through associations, through the NGOs, and all of these came to us. So it's a long-term action to give really a real alternative for these women, so they are less in contact with the health structures. So with long-term methods, they could be each month or every other month, they can have an injection. So these long-term methods are good, and so they can be satisfactory.
So this is the activities that we have conducted in terms of TCI during the COVID period. Thank you for this very detailed presentation. I noted 3 things: the strengthening of capacities. That's a very good approach. Now, there's also the fact of observing the prevention measures and having the client come to you, and you provide at that time information this is really a good approach to the COVID-19 context. You also talked about the special days where you comply with prevention measures and social distancing. You also talked about the combination of raising awareness about COVID-19 and also raising awareness about family planning. So long-acting methods were much more adopted by women during this period. But there's still a challenge that remains, and that's the permanent availability of contraceptive. And so we're going to go on to our third presentation. If you can really stick to 10 minutes, because we're only at 15 minutes away from the end of this session. So, Wab, you have the floor.
OK. Docteur, je suis là.
I am here. Thank you. So once again, I am the focal point, the AYSRH focal point at the City Hall of Ouagadougou. I'm going to talk about the elements we can use to ensure the political and financial commitment of municipalities in AYSRH and family planning activities. So I'm going to talk about the following points. Slide.
Merci.
Thank you. So what we saw in the other presentations, there's this link to the local governments. So the idea of these local governments, it's this desire to administer, it's an effort in decentralization. So this is what's happened in West Africa in the 90s. So this is a transfer from the central power to the local governments. So there were duties, for example, like health, that was transferred to the local governments to ensure the well-being of populations in their jurisdictions. Now, in Burkina Faso, this was a full transfer beginning in 2004. Where essentially local governments had to take care of anything that had to do with health. Of course, there were difficulties in this because when the central state in transferring this felt mistrust, they didn't feel that the local governments might be able to do this. And, did they have sufficient skills to do this? So this is an issue that's been found in all the countries that adopted this method of decentralization. So the TCI intervention, this kind of context where you had difficulties between the local government and the central state. Now, in the case of Burkina Faso, there was the several levels. Before TCI, the local governments that got these new duties could see how to act within this new system. So there were several paths, be it at the local, regional, national level. So with the arrival of TCI to support these local governments from a technical standpoint and other means. So for example, in terms of the City Hall of Ouagadougou, you had the regional district. We were able to implement the program. We're having an easy, we can act more easily in the regional and local jurisdictions and achieve results. So this is really a TCI approach. So it's pretty similar in all the cities where we're acting. So that everyone speaks the same language and we can deploy and implement the programs.
Alors, cela ne va pas se faire sans les défis.
So, of course, there are challenges. And so all the cities that implemented AYSRH and FP programs had challenges. In terms of Ouagadougou, the first one was to increase the use of family planning. And we had a goal of 17.2%. Now, in order to meet this challenge, we had to set up entities for the management of these programs. And then we had to make these entities function. And we needed to get the local governments to finance portions of this. Now, for Ouagadougou, there was an even bigger challenge because this was an amount of more than 82 million of CFA francs. So 40% of the global budget for the project. Before TCI, the Ouagadougou community did not contribute resources for family planning. So essentially, these were the challenges in the case of Ouagadougou, and this was similar in the other cities within Francophone West Africa. So in order to meet these challenges, we had to establish entities. So you heard about the participation of the JLTs in these entities, and that were instituted within the local government. So there was a steering committee, a coordination committee, and a gestion unit. The steering committee included the municipality, the health system, and civil society. And then for the management unit, this is just a team from the City Hall. The City Hall of Ouagadougou, on top of these two entities, they have a coordination committee. And its specific role is to manage the planning of the activities set up by the municipality and the health system. So this is a little different for Ouagadougou. So these entities, how to make them operate, these various entities. So TCI supported the local governments, the City Hall of Ouagadougou in this case, to find a way to establish collaboration between the municipality and the health system through a partnership. And this partnership was signed. So there was the mobilization of resources for the implementation, the planning, and the budgeting for the activities. The health system was supporting the local government in the implementation of the activities, the strengthening of the capacities of elected leaders and health actors. And for the management of this program that we set up. So this was all included in a document as a common agreement between the municipality and the local government. TCI is really involved in all these elements to show how these two entities could make the whole program operate. We spoke of the challenges that are present. So, and how to use the CCI approach in AYSRH programs. Now, with the pandemic, new challenges presented themselves. So in all our conversations nowadays, we have to talk about COVID-19. Now, the first thing is to ensure the effectiveness of the regular holding of meetings for the coordination entities. So how, during this COVID-19 period, how did we make it so these entities could operate. Then there was the availability of funds. With COVID-19, communities now had new priorities to protect vulnerable persons, and they were less funds because there were economic issues. So it was pushing communities to respect their commitments. And then there was a need to protect the personnel involved in the implementation of programs so that their health would not be affected. So we spoke of the challenges. So what to do, because you can't stop. We now needed to find measures, adaptation measures, in order to continue moving forward, because these programs are for the well-being of our populations. So first, we had to ensure the operation of the exchange frameworks through virtual meetings. There were some in-person meetings. You know, for the RAISE program, we felt that we needed to be there in person, but we reduced the number of participants. Now, for training sessions where trainers had to travel, we actually were able to instead do these on the internet. So that's how we were able to establish the JLTs in Niamey, in Ouagadougou, etc. This was an adaptation that made it possible to accomplish this. And then there was this, we actually reduced the procedures as well to reduce the number of supporting documents. So we used digitization for supporting documents for supporting. And so we just do this via internet. This was actually an issue prior to this, and this is how we resolved it. So these adaptation measures led to some results in all Francophone West African countries. Now, in the case of Ouagadougou, before COVID-19, prior to that, the community had spent 16 million, but in 2020, they were able to spend 30 million. So we are at a higher level of spending. And so we were able to organize several activities. And we were able to have the meetings for the RAISE evaluations, to set up the coordination unit meetings, and we had 100% rate of trainings for the number of JLTs. And then we had our advocacy efforts were carried out with mayors. And in the beginning, we had 12 mayors involved, but we have been able, even during the COVID period, to get to 27 mayors. And then in terms of milestones, we've achieved 50%. And from these elements, what do we have that enables us to ensure the sustainability of this?
The first one is in the context in the COVID-19 is strengthening use of virtual methods for meetings. So that was a success that we saw. So we were able to keep the programs functioning, and also the respect of all the measures and vaccination, the barrier measures. But these are also things that we can base on. So we can see images where in meetings, people are on the barrier gestures, and also you can see the things that people have to do, like wear a mask and social distancing. Slide, please. So all these elements also are the ones that allow us to ensure the continuity of the political and financial commitment. It's also joint meetings between City Hall and the health system to comfort people who are on the ground. So the healthcare systems have to be involved in the implementation of the program. Another element is the advocacy actions by JLTs, so that continue to ensure political and financial commitment, and also sharing of experience between GLTs of various countries in Francophone West Africa. You can see an image here, a joint meeting, mayors on one side, and healthcare system managers on the other hand. So that's an image of a joint meeting on the ground. So we are trying to see if ISBC was implemented, if it was effective, and this being said, I thank you. Thank you, Wahab. Thank you for your presentation. That we summarized the other two, because the political commitment is necessary to support the action of JLTs and also the strengthening of the services. So we had some comments, and really very good comments, but there were some questions also that were asked. And I would like to ask the panelists for whom this question are asked, so to bring some elements of answer. So one participant from Cotonou here says that we had also a memorandum that standardized the cost of consultative products. That's true. Now, there's one question that went directly for Mrs. Koulibaly, saying, can we have the statistics about COVID for the Abobo district and the acceptability of the barrier measures at the community level? So what about the acceptability of barrier measures at the community level, and what are the COVID statistics in the district of Abobo? Okay, I'm going to give the most recent figures. Go ahead. 2021 figures. Where the interpreter apologizes, the sound disappeared and the interpreter could not hear the number. And how about acceptation of barrier measures by the communities? For each healthcare center, the district has put some hand washing stations, and that allows all the users to at least wash their hands, and they also have to wear face coverings. So that's, but as you know, when they come to see us, that's in the healthcare center, but when they are in the center, they are protecting themselves and they are protecting us as well. Thank you, Mrs. Koulibaly. There's an important comment that if contraceptive products are out of stock, it's a big challenge because it has an impact on the results. So there's a question for Wahab. Given that municipalities function on elective patterns, does TCI have an experience to share for institutionalization of these strategies to avoid a constant reinventing of the wheels at the time of elections? Wahab, what can you tell us about this? I see Wahab is not online. Yes, I am here. Now, did you hear my question? Can you just repeat it? So it's a question that is asked by a participant. I don't want to give the name, but so since municipalities function on elective patterns, does TCI have an experience to share for institutionalization of these strategies to avoid a constant reinventing of the wheel at the outcome of elections? Thank you very much. I think about this, starting with the patterns that are already in place. When we take the case of Ouagadougou, it's true that we are functioning on an active system, but experience to share is that the program relies more on the agents more than the elected officials. The elected official is more for mobilization of resources, but the actors that animate the programs at the municipality level, when we take the case of Burkina Faso, and so they are not related to the electoral regimes. So even when the municipal authorities change, there's always something that the population can use. Of course, if there are new authorities, the same people do the advocacy work. And so that's the fact that the GCI model relies on something that on people who are not bound by the electoral system, but really agents. Thank you, Wahab. And I wanted to add also that the actions are within the framework of an action plan. So it's not really a change at the top of the city hall that will change the actions of the city hall, because it's in a development plan for the communities where we operate. So we saw a lot of cases of elections, and that's about what we understood through the situation that we lived. But we will still pay attention to this problem. So there's a question of things that are out of stock. Came back from Mrs. Koulibaly to say that it would be interesting to share with us identify causes for the fact that things get out of stock, and what can be done to prevent that. This is a question that is maybe for Mrs. Koulibaly, and maybe there are other questions. So I'm going to let Mrs. Koulibaly answer, but we're already at the end of the time that we have. So I'm just asking maybe 2 or 3 minutes so that we can answer this question. Mrs. Koulibaly, can you give us some answers about this concern related to contraceptive products being out of stock? Okay, so it's a problem that is really serious and even recurring, because next week we have something, and for now we don't have the product that we need. It's something at the national level. They ask us to be patient, but the true. Mrs. Koulibaly, does the population embrace easily the promotion of long-term methods? That's a question that is asked by a participant. And what would be your strategy if people are reluctant? The sound is really broken up. So population embrace easily, is that it? Because we showed them that these measures are good. Okay, so a question that says, not necessarily related to COVID, but about your interventions. It can also go for others, but first of all, Mrs. Koulibaly, do you encounter cultural constraints for embracing the FP methods, especially the behavior of the attitudes of husbands? Mrs. Koulibaly? Well, we cannot talk in public here. We can talk about that in public, but the interpreter apologizes, but it's impossible to hear the answer. The interpreter apologizes again, but the sound is really broken up. Many questions for Mrs. Koulibaly here. Sorry, Josefa. There are many questions, yes, from Mrs. Koulibaly, but there is one question that was asked to by Krishna. I don't know if you saw it. The question is for GLTs about the virtual training by internet. Is there sufficient access by members? And she says also a WhatsApp-based training can a WhatsApp-based training supplement these efforts? Okay, Lorraine. Lorraine? Yes, I'm here. Did you hear the question? Yes, I heard it. I saw it. Okay, let's go. Okay, I would say, first of all, that yes, WhatsApp allows us to supplement this because already all GLTs have a WhatsApp group and that allows to pass information and to receive some documents so that equip us for the activities we have to do throughout the program. Okay. I don't have anything to add. Is there another important question like this? Fatima would like to see answered. Otherwise, in 1 minute or two, we're going to end this session. Fatima? Yes, there are many questions. And I'm thinking that since we are over the time that we had for this webinar, I would propose that we answer these questions by email, and I can get back to the participants by email, if that's okay. Okay, thank you. That's not a problem. We're going to do this work. It's important work. We had lots of comments, lots of congratulations for our panelists who are very brilliant. And yes, like we have the manager of the TCI platform that is here, and I don't know if she would like to say some closing words to really close this webinar. Mrs. Talas, Mrs. Tala, if you want to say a word, otherwise maybe I'll do it. But I would have loved to hear you say a word on this webinar.
Merci Josefa et toutes mes félicitations à tous les panélistes.
Thank you, and all my congratulations to all the panelists. This was an hour and a half of learning, and this was really impressive, I think. I think COVID has, we've had to learn how to adapt, and COVID has taught us this. And it really was interesting to see how everyone, depending on what they're doing, they was able to look at what has been done for years and to go back and use practices that weren't used prior to this. So thank you. And to the panelists and all the participants who joined us. Thank you, and see you next time. And thank you to all the participants. This webinar has ended. Thank you.
Ah,